Hi, welcome to Menopause Natural Solutions That Work webinar. We're so glad that you're here with us this afternoon. We've got a really great webinar ahead for you, and hopefully, we hope that you will be educated and hopeful, leave hopeful after the time this webinar is finished. I'm Brooke Beasley, and your host for the webinar today, Dr. Stephen Hotze. He is the founder, CEO of Hotze Health and Wellness Center, Physician's Preference, Hotze Pharmacy, and he's also a speaker, radio show host, author, and we're so glad to have him on today. Dr. Hotze, welcome.
Thank you so much, Brooke. Thank each one of you for joining us here for this webinar to discuss the issue of menopause. And really, we're going to talk about a broader subject than just menopause. We're going to talk about the whole issue of hormonal decline that occurs as a woman marches through her menstrual life. So let's start with the definition of menopause. What is menopause? Well, menopause is simply a time in a woman's life when she ceases to have her normal menstrual periods. At least for 6 consecutive months, once that happens, she's considered to have gone through menopause. This usually occurs around the age of 50 years old, although the symptoms of menopause, which are known as perimenopause, can start much earlier, even in a woman's early to mid-40s. What causes menopause? Well, it's the cessation of ovarian function. A woman's ovaries no longer produce eggs. That means they no longer ovulate, and they no longer produce hormones. You've heard of it commonly known as the change of life. Even though it's a normal part of a woman's natural life cycle, it isn't a healthy situation because hormones enable the body to function optimally. When the hormone levels decline and you cease making your natural occurring sex hormones, that's when illness and health problems occur. So what are some of the symptoms that a woman may experience in menopause? Well, she can develop hot flashes, night sweats, vaginal dryness, insomnia. Moods can become depressed. Romantic moods and inclinations can be dramatically reduced. She has bone loss. Cancer can develop, migraine headaches, increased incidence of urinary incontinence, vaginal atrophy, and frequent urination. At our center here at the Hotze Health and Wellness Center, our goal is to work with women to help them resolve these menstrual symptoms naturally and not with pharmaceutical drugs. So the underlying cause of menopause is the inevitable decline of a woman's natural occurring hormones, her sex hormones. Estrogen and progesterone are the 2 key sex hormones that women's ovaries make. In the first half of the month, a woman makes only estrogen. She makes estrogen all month long, but in the first half of the month, the only sex hormone that is being produced is estrogen. And there are 3 types of estrogen hormones. There's estriol, estradiol, and estrone. They are produced starting on day 1 of the menstrual cycle. She starts producing low amounts and increasingly larger amounts of estrogen until mid-cycle. In mid-cycle, a woman will ovulate, and that means she gives off an egg. At that point, she begins to produce progesterone. Progesterone promotes gestation, promotes pregnancy. It matures the inner lining of the womb that has been proliferating from the estrogen effect. It matures it, preparing it for a potential pregnancy. If, in a perfect world, after 28 days there is no pregnancy, then a woman's ovaries cease or have a rapid decline in hormonal production, both of estrogen and progesterone, which leads to a sloughing of the inner lining of the womb, which is known as the menstrual period, and the whole cycle starts all over again. Well, when a woman hits midlife, mind you, puberty occurs somewhere around the age of 14, 15, 13 even, in some women younger, but somewhere in that age group. That's when a woman starts to make her natural occurring hormones. And it usually ends at about the age of 50. Nothing is the same when a woman, hormonal production changes over a woman's lifetime. So as she begins to enter puberty, her ovaries have to turn on and start to produce adequate levels of estrogen hormones and progesterone. A woman reaches her peak somewhere around 20 or 22 in hormonal production. She's most fertile, in the time from soon as she's most fertile in her late teens, early 20s. And as a woman matures and hits into her 30s, something happens. The ovaries are aging, and she produces lower levels of progesterone, and her hormones oftentimes become imbalanced. There becomes an imbalance between the estrogen hormone and the progesterone hormone. As a woman moves into her mid to late 30s and early 40s, she often has anovulatory cycles. That means she has menstrual cycles where she doesn't ovulate. And in those cycles, when she doesn't ovulate, she makes no progesterone. So the only hormone that's having an effect on her uterus then is the estrogen hormone, and it's a proliferative hormone. What happens then is that the periods, which maybe were light, lasting 3 days to 5 days, now start to last 5 to 7 days. And as a woman marches through her menstrual life, when she has more anovulatory cycles, or cycles in which she doesn't produce any eggs, she begins to have heavier and heavier bleeding. So the periods may last 9 days, 10 days, 12 days. She gets heavy bleeding and clotting, and then she starts to have breakthrough bleeding. This is known as dysfunctional uterine bleeding. And that is caused by an imbalance between estrogen and progesterone. That condition is known as estrogen dominance, and we're going to talk a little bit more about that in just a minute. Even after a woman goes through the change of life or goes through menopause, she still does have estrogen in her body, especially if a woman's overweight, because the fat cells in her body will make some estrogen. So she may have as much as 30 or 40% of the estrogen that she used to have when she was younger. But she makes no progesterone. And also the ovaries, interestingly enough, produce testosterone in women. And that testosterone peaks at ovulation, which I think is rather appropriate, because one of the effects of testosterone is to increase a woman's desire for intimacy. And obviously, the way God set it up is that when you ovulate, ladies, that you get a little testosterone, so that husband that hadn't looked all that attractive all month long also all of a sudden looks like a knight in shining armor. So testosterone can have that effect. Estrogen dominance. Okay. Estrogen dominance occurs when a woman has a deficiency or an imbalance between her estrogen hormones and her progesterone hormones. This oftentimes, as I mentioned earlier, occurs in midlife at about the age of 35. It can occur immediately after any pregnancy. It's not at all uncommon for us to see women after pregnancy, even in their 20s, to develop estrogen dominance and a progesterone deficiency. What happens during pregnancy is that the baby's placenta produces the hormones of pregnancy, and the ovaries are shut off during the last 6 months of pregnancy. So a woman makes no hormones on her own. When the baby is delivered and the placenta follows, then all of a sudden there is a dramatic decline in a woman's natural hormones. And this often leads to significant symptoms. One of them commonly is postpartum blues or postpartum depression. That's simply a hormonal decline and an ineffective restart of the ovary, so they begin to produce the hormones. And that leads to, it can lead to a host of symptoms because a woman becomes estrogen dominant, that she doesn't make any progesterone. And it can lead to a whole host of symptoms besides postpartum blues. She gets fatigue, difficulty with weight, her metabolism changes, she doesn't sleep well. And that can be easily corrected. So You ladies that have that have daughters that are in the childbearing age and they've had some problems after pregnancy, their metabolism changed, or they had postpartum blues, a simple remedy for that is to restore natural progesterone. That can be taken orally by cream. Natural progesterone can be very helpful, and oftentimes a little bit of thyroid, desiccated thyroid preparation can be helpful too. I'll say this: I have 5 daughters, all of whom have had children, and I made sure when our daughters went to the hospital to have the babies, they had progesterone. And I told them the day after that baby is born, the next morning you start on your progesterone. And none of our kids ever had any problems with postpartum blues or postpartum depression or any of the symptoms of change in metabolism because they took their progesterone, and also a little bit of thyroid helped them. Well, when a woman has estrogen dominance, symptoms are very, very noticeable. You'll develop premenstrual headaches, you can have fluid retention, weight gain, fibrocystic breast disease, uterine fibroids, heavy menstrual bleeding, endometriosis, clinical hypothyroidism, and bone loss. Now, let me talk about hypothyroidism. When a woman has estrogen dominance, when she makes less progesterone, when her progesterone levels fall and she has an imbalance between estrogen and progesterone, that causes her liver to produce high levels of a protein called thyroid binding globulin, TBG. And what do you think thyroid binding globulin binds to in the blood? Well, it binds to thyroid hormones. So the thyroid hormones that are produced by the thyroid gland in the neck, which govern your body's metabolism, your energy production, all of a sudden get bound up in these proteins because of estrogen dominance. And they can't get into the cells in adequate amounts. So while you may have thyroid in your blood, it's bound to protein that inhibits its ability to be assimilated and utilized by your cells. Every cell in your body needs thyroid hormone to produce and use energy. So what happens is then you don't get enough thyroid in your cells and you become clinically hypothyroid. And those symptoms would be fatigue, tiredness, cold sensitivities, cold hands, cold feet, low body temperature, maybe a difficulty with weight, insomnia, brain fog, loss of romantic moods and inclinations, joint and muscle aches and pains, depressed moods, panic attacks, anxiety attacks, constipation or irritable bowel function, hair falling out, puffy, pale, a thickened tongue, loss of the lateral third of the eyebrows, recurrent and chronic infections, dysfunctional menstrual bleeding. These are symptoms of low thyroid within the cells. It may be caused by 2 things. You may not be producing enough thyroid in the gland. You may have a condition called autoimmune thyroiditis, where you make antibodies to your thyroid gland, or you may have estrogen dominance, where you make thyroid binding globulins from the liver that bind onto the thyroid hormones and don't allow them to be assimilated. One way or another, you don't get enough thyroid into your cells, so your cells don't produce enough energy, and your metabolism goes down, and you don't feel well. And so you eventually end up back in your doctor's office, and you ask your doctor, "Doctor, I've got these symptoms. What is wrong with me? Do you think I could have low thyroid?" Because you probably have gone on the Googled your condition and saw that your symptoms are related to hypothyroidism, and you ask for a test, and the doctor runs the test, not telling you you don't have hypothyroidism, but we'll run the test anyway. And you run the test, and by the time you finally get the results, after waiting usually a while, you either see the doctor back in person or you get a call from the nurse and you're told your blood tests are what? Normal. How does that make you feel? You've had these terrible symptoms going on that sometimes can be debilitating. They adversely, let me ask you, when you have these symptoms, how does that affect your work? How does it affect your relationship with your spouse? And how does it affect your relationship with your children and your friends? How does it affect the way you feel about yourself? What I've been told by many women is that when the doctor tells her that everything's normal, your blood's in the normal level, I just think you need a little bit of antidepressant. Well, they tell me that they feel that the doctor's acting condescendingly towards them, or that he makes them feel like they're hypochondriacs or neurotics and are hysterics. And they feel very down and discouraged because they have a role to play and they want to play that role in life with their husband and family and friends, and they want to feel good about themselves, and they don't now. And the antidepressants that they're given have very serious side effects and are very dangerous and can cause some serious symptoms of side effects, such as increased depression, for which you go back to the doctor and say, "Doctor, I didn't really feel depressed, but I'm depressed now." And the doctor will say, "Well, you need more," and he'll put you on heavier doses or several different types of antidepressants and anti-anxiety medication, and then he'll give you sleep medicine. All these are addictive drugs. They can't be stopped immediately. You have to withdraw off these drugs. But the side effects of the antidepressants are more depression, increased suicide rate, increased rate of homicide, aggression, outbursts of anger, weight gain. Yeah, weight gain. You go to the doctor, he said, "I'm getting a lot of weight and I'm tired." He gives you an antidepressant. You gain more weight. You think you get happier or sadder. You're depressed. Also, the loss of romantic moods and inclinations, or libido. It affects the emotions, because these drugs affect your brain chemistry, neurochemistry in your brain. Okay, so how do we treat the decline and imbalance of hormones as a woman marches through her menstrual life and as she moves into menopause? Well, a key hormone that needs to be taken by women is the hormone progesterone. Remember, that's the hormone of the second half of the month. That's the hormone that a woman makes when she ovulates to balance out the estrogen. So when a woman develops the symptoms of estrogen dominance in midlife or after childbirth, those can be easily ameliorated by simply replenishing on days 15 through 28 the natural occurring hormone progesterone to balance out the estrogen. So here are some of the positive effects that progesterone has. Of course, it balances the estrogen, eliminating the condition of estrogen dominance. It enables the body to properly utilize thyroid hormones. It reverses osteoporosis. It relieves fluid retention and migraine headaches. Let me just say something. How many of you know someone who has migraine headaches that are cyclical? They occur sometime every month about the same time. What do you think that would mean if it's cyclical and related to your menstrual cycle? It's hormonal. Very commonly, estrogen dominance causes severe headaches and even migraine headaches that can be easily eliminated with natural progesterone. Now, the low progesterone is not the only cause of migraine headaches. They can be related to foods. There can be food allergies causing them. But commonly in a woman's life, if they are cyclical and they happen just before the time she has her period, you have migraine headaches 2 to 3 days or 4 days before your periods, or at the same time in the month, that indicates that it is more than likely hormonal, and you deserve a therapeutic trial of natural progesterone. Also, progesterone enhances your moods, thereby relieving depression and anxiety. Commonly, we see women in their 30s and 40s, and as they march towards menstrual life, having panic attacks, having anxiety attacks, and feeling depressed. That is caused by the decline in natural occurring hormones, particularly progesterone, because the hormones affect the brain chemistry. They don't just affect the uterus. Every cell in your body is affected by your sex hormones, particularly your brain. I'll just say this. No one of you has panic attacks or anxiety attacks or depression because you have low levels of antidepressants or low levels of anti-anxiety medication in your blood. When you were young and felt great, you didn't have antidepressants in your system, and you didn't have anti-anxiety medication. You had a good level of your natural hormones that were well balanced. Well, that's what needs to be corrected. When the imbalance and decline in your hormone occurs, which isn't just at menopause, it happens far before that. Many of you go back and ask yourself, or I'll ask you, how long have your symptoms been occurring? Did they just start when your period stopped, or have you not had symptoms going on for 5, 10, even 15 or 20 years? I have women that come in and tell me, I felt bad since puberty. Ever since I started having my periods, I felt terrible. Their hormones never were right. And oftentimes when they're young, they were put on birth control pills, which further exacerbate the problem of hormonal imbalance and clinical hypothyroidism, cause a host of symptoms. Or they were put on it, then they're put on antidepressants or anti-anxiety medication. Then you're on the rest of your life, you're on psychiatric medications, which affect who you are and affect how you feel about life and how you feel about yourself. So all because the doctor didn't understand and know how to properly balance out your hormones with your normal occurring hormones. Okay. Several other positive effects of progesterone. It enhances sleep. It also enhances your romantic moods and inclinations, ladies. And it protects against breast cancer. This is an important point. As women march through their menstrual life, the incidence of breast cancer increases as they develop estrogen dominance. There was a study done and printed in the American Journal of Epidemiology in 1981. It's been over 30 years. And I read about this first back in 96. The study is from Johns Hopkins School of Public Health, and they evaluated women who were infertile, and they put them in two classes: women that were infertile because they had mechanical problems, and women who were infertile because they had low levels of progesterone. Well, they followed them for 20 years, and there were thousands of them that were followed. And what they found is that the women that had infertility due to low progesterone levels had 540% increase in breast cancer and 1,000% increase in mortality from all cancers. Progesterone inhibits, and progesterone deficiency increases your risk of breast cancer and all cancers, and adequate levels of progesterone decrease your risk of breast cancer and decrease your risk of mortality from other cancers. It's a key hormone, and this is what happens when our hormone levels, both in males and females, as they decline. That is what leads us to become unhealthy and get a whole host of health problems that ensue after menopause, or as men go through what we call andropause, which happens at about the same time. Now, the whole issue of hysterectomy and how that can lead to what we call surgical menopause. The term total hysterectomy is used by the lay population to indicate that the uterus has been removed and the ovaries have been removed, when in fact that's really not a true definition of total hysterectomy. But for your purposes, we're going to call it a total hysterectomy as both the removal of the uterus and the ovaries. In fact, a total hysterectomy is only the removal of the entire uterus. A partial hysterectomy is a partial removal of the uterus, and the cervix is left. What happens, or the proper term for removal of the ovaries, is oophorectomy. So if a woman has her uterus completely removed and the ovary removed, she would have a total hysterectomy and oophorectomy. That's the correct terminology. But for the lay public and for you, we'll just consider at this time that the total hysterectomy involves the removal of the uterus and the removal of the ovaries. Now, if this occurs before a woman goes through the change of life or into menopause, she will have what we term surgical menopause. And this is oftentimes viewed by a physician as the only option when a woman has dysfunctional uterine bleeding. I am sure many of you have already gone through a hysterectomy, and more than likely that was due to either uterine fibroids which your doctor said is causing you to have dysfunctional uterine bleeding, and the only way we can stop the bleeding is do a hysterectomy. Well, let me just tell you what, you do a hysterectomy, you'll stop the bleeding. But the real issue is, why were you having abnormal bleeding? Well, you said the doctor said you had fibroids. Why do you have fibroids? Because of a condition called estrogen dominance. Estrogen dominance, the imbalance in female hormones that occurs in midlife and goes all the way until the change of life, leads to dysfunctional uterine bleeding and fibroids of the uterus. That can be easily treated and should be treated early on. As soon as those symptoms develop, a woman should be given natural progesterone. That will balance out the estrogen and prevent the dysfunctional uterine bleeding. And even if you have dysfunctional uterine bleeding now, oftentimes if you start on progesterone now, you can obviate the need for having a hysterectomy. But remember, OB-GYNs are surgeons, and surgeons are trained simply like this. I did a year of surgery, by the way, in residency, and the motto was, a chance to cut is a chance to cure. So they're trained to do surgery, and so they're going to take out the uterus. That's their solution. But it doesn't resolve the underlying hormonal problems that were there. As a matter of fact, it creates new problems, because when the ovaries were removed at the time of a hysterectomy, it caused a drastic drop and elimination of hormone production. It's different than the symptoms that occur as a woman marches towards menopause naturally and has slowly declining hormone levels. That's different. The symptoms are much stronger when you immediately have cessation of all hormone production overnight. So even if a woman has what you might call, in lay terms, a partial hysterectomy, where she only has the uterus removed, let's say, which would be a total hysterectomy, by the way, in medical terms. But if the ovaries are left after she has a hysterectomy, that adversely affects the blood supply to the ovaries. The ovaries have blood coming from the uterine artery and the ovarian artery, and when you do a hysterectomy alone without removing the ovaries, the blood supply is compromised. And what happens is that you will eventually develop a significant decline in your ovarian hormones and go through the change at much earlier age. They usually shrivel and die within a couple of years. This can also happen after tubal ligation. So a young woman in her 20s or 30s can have her tubes ligated. Well, guess what? That cuts off the blood supply, and they get post-tubal ligation syndrome, which is a dramatic decline and imbalance in their hormones at a young age. Well, what are the conventional solutions? Well, we've talked about hysterectomy. And I might just note here that there are at least 600,000 hysterectomies performed annually in the United States, many of which are unnecessary. I had a guest of ours here at the Hotze Health and Wellness Center that told me she had severe migraine headaches, and her doctor said, well, sometimes it's helped by doing a hysterectomy. And she let him do a hysterectomy to get rid of migraine headaches, which don't get rid of migraine headaches. Migraine headaches, as I mentioned earlier, are oftentimes caused by an imbalance and decline in natural progesterone. That doesn't give you natural progesterone to remove the uterus. Many of the hysterectomies performed are unnecessary. That's been documented. Once a woman goes through the change or has surgical menopause, she is commonly prescribed a drug called Premarin, which is horse estrogen. The term Premarin comes from a shortening of pregnant mare urine, Premarin. So all the hormones, the sex hormones, are secreted in the urine, both in all mammals. So when the mares are pregnant, they collect their urine, they extract out the hormones and dry them and put them into powder, and they give them as medication to women. Now, if these hormones were identical to the hormones that a woman makes that would be fine if they're given the proper dose, but they're not. Half of the estrogens in Premarin are horse estrogens that are not produced in the human body, so they're not natural to the human. I think Premarin's a good preparation for mares in midlife, but I don't believe it's good or healthy for women because it's not your natural occurring hormone. Oftentimes, but it is an estrogenic compound, and it leads to estrogen dominance. Very commonly, that's given without any progesterone or any, oftentimes and almost always given without any balancing natural progesterone. There is another product called Provera, which is a progestin, which is medroxyprogesterone, but it is not progesterone. It is a chemical counterfeit made by drug companies, doesn't occur in nature, that the drug companies tell doctors to use to balance Premarin. And it's oftentimes given as a single medication called Premprose, standing for Premarin and Provera. The Women's Health Initiative indicated that this regimen of counterfeit hormones leads to an increased risk of breast cancer, heart disease, blood clots, and strokes. And as a matter of fact, they stopped the Women's Health Initiative in 2002 because of the increased incidence of these problems. And mind you, a third of the women that started in the Women's Health Initiative dropped out because they felt so bad on these drugs. Women tell me when they take the Premarin, they feel awful. It causes them to get all the signs and symptoms of hypothyroidism, which of course they develop because the Premarin leads to estrogen dominance, which leads them to produce thyroid-binding globulins. Oftentimes, doctors treat the symptoms of menopause and perimenopause and hormonal decline and imbalance with antidepressants, anti-anxiety medication, sleep medication, and biphosphonates to help bone enhancement. Now, none of these drugs occur naturally in individuals, and there is no way. I mean, if the reason you feel sick is because your hormone levels decline, why in the world would you take a drug that never existed before in nature and has no natural function in your body? And why would you take that or why would a doctor prescribe that when he could prescribe you your natural occurring hormones? Kind of like this: when you're driving a car and your gas gets low, you go to the gas station and you put what in the tank? You put gas in the tank. When the gas gets low, you put gas in the tank. You don't put water in it. You don't put Coca-Cola. You don't put oil. You put gas. That's the same thing with the hormones. As your hormone levels decline, think of it as being a tank. If you want to feel well and feel optimum, you want to fill the tank back up. I like to say it like this. If you were driving from Houston to Dallas and you were sitting on an eighth of a tank of gas, before you left, you more than likely would fill up. Why? Because an eighth of a tank of gas isn't going to get you to Dallas. Well, it's the same with your hormones. As you age, your natural occurring hormones, your thyroid hormones, your female hormones, and your adrenal hormones decline because the glands aren't producing as much. They decline. Where you were once at an optimal level and felt really good, now the decline, even though it falls within this wide range of normal, it declines. You're not at an optimal level. And so your energy level goes down and you get a host of these symptoms. So what is my solution? And what is the solution we use at the Hotze Health and Wellness Center that we've developed? Well, we replenish your hormones with the same identical hormones that God put in your body to begin with. Natural progesterone, natural estrogen, natural thyroid when indicated, and when your adrenal glands are fatigued, natural cortisol. These hormones are bioidentical hormones. That means they're biologically and molecularly identical to the hormones your body made, so your body sees them as if it made them, as if your body made it itself. And they work and function naturally. They're safe, they're effective, and they're very reasonably priced. They're no more expensive and probably less expensive, much less expensive than the drugs that doctors prescribe, the antidepressants and the anti-anxiety medication. So it's much more cost effective, and it's natural and it's safe, and you'll feel normal. Okay, I often say this. Are you sick and tired of being sick and tired? A lot of you are. Or you have friends that are sick and tired of being sick and tired. And my thought is, you don't have to stay that way. It's your choice. We've helped at the Hotze Health and Wellness Center over 25,000 people get on a path of health and wellness so they can enjoy a better quality of life. We've helped them, as they say, get their lives back. So we would count it a privilege and an honor if we had the opportunity to partner with you to help you regain your health so that you can obtain health and wellness naturally. And we want you to do that because we want you to restore your health so that you can transform your life. And when your life is transformed, then you can improve the world around you. And you can do this naturally. You don't have to be drugged up. Now, I've written 2 books. One entitled Hormones, Health, and Happiness that was published in 2005, and my new book, which just came out, entitled Hypothyroidism, Health, and Happiness. And you can get a complimentary copy of Hypothyroidism, Health, and Happiness. I want you to have a complimentary copy. I want everybody that wants a copy of this book to have it. The reason is it will help you understand how your hormones and the decline of your hormones adversely affect your health and what you can do to replenish your hormones and get yourself on a path of health and wellness. To obtain this copy, just go to the website thyroidanswer.com, thyroidanswer.com, and you'll get a free copy. We do have an $8.95 charge for shipping and handling, but you'll get the book free.
Alrighty, and let me interrupt just for a quick second. I wanted to make sure before people started tuning out, this is not the end. We're going to be here for a few more minutes, several more minutes, taking your questions. Dr. Hotze is going to be here answering those questions for you. And a few people have already tuned in, and you can type that question in the chat box on your screen. I'm going to go ahead and pass it off to Dr. Hotze. But Dr. Hotze, we'll start with this. The first question is from Ramona. She says, how often does a female have to take progesterone? Is this a life process, and does insurance sometimes?
Well, progesterone, a woman should take progesterone the rest of her life. When you start taking progesterone, whether in your early 30s, mid-30s, 40s, or 50s, when you take progesterone, take the progesterone on days 15 through 28 while you're menstruating, and then we put our women on progesterone to balance out estrogen. Once they go through the change of life, we have them take that every day. So that's our recommendation.
I'm sorry. I think I cut Dr. Hotze off. I apologize for that. I think you wanted to say one more thing. Okay, great. And our next question is from Debbie. She says, is this the case also with tubal ligation? And looking at the time that she submitted that about 20 minutes ago, I'm assuming you were talking about estrogen dominance, Debbie. Dr. Hotze, will you answer to that?
Well, as I mentioned, bilateral tubal ligation adversely affects the body's ability to, or it compromises the blood flow to the ovaries, and they produce lower levels of the hormones, and it can send women to early menopause. Okay, what other question do we have here? I'm 46 and my body begins to feel, I'm sorry, wrong one. Why does your period start while using progesterone cream, even just getting off the period? Why does your period start while using progesterone cream? Well, it's because if you're you're asking if you're taking the progesterone day 15 through 28, and while you're on it, your period starts, that tells us that your estrogen hormones have dramatically fallen, and that's what causes the menstrual cycle to begin. Thank you very much. I'm 46 years old and my body's beginning to feel different, mostly hotter and less tolerant. I'm taking progesterone in days 15 through 28 of my menstrual cycle. Well, you're in the perimenopausal stage, so not only, you're right by being on the progesterone, but now you probably will benefit from being on a little bit of estrogen as well if you're starting to develop hot flashes and night sweats and some of the symptoms of estrogen decline. What will happen if the bill passes that limits us getting natural hormones? Well, let me tell you about that. Senate Bill 959 is a bill that would give FDA control over compounding pharmacies where most women, or all women, get their bioidentical hormones across the country. So there are millions of women that take women who take bioidentical hormones that are prepared by compounding pharmacies. Compounding pharmacies also make other preparations as well. What compounding pharmacies do is they take bulk ingredients and they customize them based upon a prescription for the patient written by a physician. Now, the big pharma, and we're talking about the large pharmaceutical companies, don't like the fact that compounding pharmacies compete with them. So they have worked, and they work closely with the FDA. As a matter of fact, the FDA is in their pocket because 25 to 30% of all the income of the FDA comes from drug companies that pay a prescription drug user fee. There was a bill passed in 1992 that said this basically, and that the pharmaceutical companies agreed to, that they would pay a prescription drug user fee. Part of their profits would be paid to the FDA, or the revenues would be paid to the FDA if the FDA would speed up the approval process. Marriage made in heaven. So guess what? The FDA is a client of the pharmaceutical companies. The pharmaceutical companies have done everything they can to get the FDA to restrict and even eliminate bioidentical hormones. So if the FDA is given power over bioidentical hormones, I believe that will inevitably lead to the elimination of bioidentical hormones. You won't be able to get them from compounding pharmacies anymore. The rules will be drafted by the FDA. It doesn't say in the bill that the FDA will, or that bioidentical hormones can't be given, but the FDA, by its actions over the last 10 years that I've been fighting the FDA, that's their intent, is to get rid of compounding pharmacies so they don't compete with the big pharma anymore. And that's just wrong. So we're fighting Senate Bill 959. And I want to encourage you, if you have a pen, take this down, and you can go to a website called My Meds Matter. That's MYMEDS Matter, mymedsmatter.com. You go to that, just click on bioidentical hormones. It'll come up with a page. You put in your zip code and your name, and up pops a email letter that you can send to your United States Senator. If you live in Texas, your senators are John Cornyn and Ted Cruz. Senator Cornyn has been the leader in the opposition to this bill. I've met with him personally. He said he would lead the opposition. What we're trying to do is hold this bill off and stop it. We have been working now for 2 months to stop this bill. We stopped it from being brought up in June. We stopped it from being brought up on the 4th of July. We're in the last week before the summer recess, which lasts all of August for the Congress. So if we can just hold it off for the next 3 days. So the most important thing you can do now is call your United States Senator. If you're out of state, go to a website and just type in phone number for United States Senate, and you can look your senators up and call him up, send him an email, tell him vote no on S959. You want to protect your ability to get bioidentical hormones. And we've been very successful so far, but we're in the last stretch. We've got to hold it off this week. It's so critical and so very important, so please make sure you do that. Here's a question, and it comes from Trey. I use bioidentical hormones and Armour Thyroid. I avoid sugar and carbs. Why am I still tired in the afternoon and then fully awake at bedtime? Well, Trey, good question. I don't know what your dose of thyroid hormone is and whether you're taking divided doses or not. If you're taking a divided dose, then I would recommend you take all your dose in the morning of your thyroid, and it may be that you need a little more thyroid. If you're having problems sleeping at night, it's probably because you have low levels of melatonin. That's what occurs as you age, and so you can take melatonin. I'd get the 3 milligram, and you can take 3, 6, 9, 12 milligrams. You really can't, you can take 100 milligrams of melatonin, and you're not going to have any side effects. They've done studies with college students taking 1,000 milligrams and have no side effects. Don't even feel groggy the next day. But 3 to 9 milligrams of melatonin should be adequate to help you sleep well. There's some other, I happen to have at our pharmacy, our vitamin store, Physician's Preference, a formula that I've created called Dr. Hotze Sleep Formula, which has 5-HTP, valerian root, and melatonin in it, among some other sleep natural herbs that help encourage sleep, so you might try that. Yolanda asks, what's the story about eating yams and vitamin E for breast health? What does progesterone cream really do? Thank you, Yolanda. Well, we've gone through the whole gamut of the benefits of progesterone. Progesterone is a hormone of the second half of the month. It balances out estrogen. As women age, the progesterone levels fall and they get estrogen dominance, which leads to clinical hypothyroidism and dysfunctional uterine bleeding and fibroids and a host of other health problems. It also leads to mood swings, depressions, panic attacks when you have estrogen dominance. Progesterone stimulates bone formation, gets rid of fluid, helps balance out your estrogen, so it eliminates your headaches. It helps you sleep well. It's a very, very essential, important hormone. It's a balancing hormone. Think of it as yin and yang. You've got the estrogen and the progesterone. They've got to balance out. And what about eating yams? Well, if you want to have breast health, you want to have progesterone, not yams. Yams are good for nutrition, but they do not contain progesterone, and that is not the way to balance out your estrogen. You need to balance it out with progesterone. Okay. Here's Yolanda, a different Yolanda, I presume. Help. I'm tired of taking iron due to heavy bleeding. What about an overload? I use progesterone, no sugar, flour, and work out. Well, I don't know what your dose is of progesterone. But if you're still having uterine bleeding, what we would normally do is we would increase the dose of progesterone. So you might discuss that with your physician.
Alrighty, I want to go ahead and pop in for a minute because I noticed some really great questions that I want to make sure we get to from Brenda. She says, what is the best form of estrogen for postmenopausal if I'm on bioidentical testosterone? I'm experiencing extreme vaginal dryness plus frequent UTIs. Oh, okay. Technical difficulty.
But it doesn't show up on my screen. So repeat that question again.
Sure. The question is from Brenda. She says, so she says, what's the best form of estrogen for postmenopausal women? Basically, she's taking testosterone right now, but I think she wants to know what other hormones would be good for her.
Well, we recommend at our center Bias, which is a combination of estriol and estradiol, and that's available at any compounding pharmacy that makes bioidentical hormones. And here at our pharmacy, Hotze Pharmacy, we have different strengths depending on what the doctor recommends of Bias, which is a combination. So that's B-I-E-S-T, Bias, which means 2 estrogens. Leslie asks, do you really need progesterone with estrogen if you've had a hysterectomy and you're through with menopause? I am 56 years old. Absolutely. If all you take is estrogen, even if it's a bioidentical estrogen, you're throwing yourself into the state of estrogen dominance, which causes high levels of thyroid binding globulin, which bind onto thyroid hormone and adversely affects your ability to properly utilize and assimilate your thyroid hormones, which puts you in a state of clinical hypothyroidism. So, absolutely. And plus progesterone, you know, the estrogen dominance causes a host of problems. It also, in the estrogen dominance, I mentioned to you earlier, low levels of progesterone increase the risk of breast cancer. Progesterone causes apoptosis. That means when they put cancer cells in a petri dish and they put progesterone on it, it kills the cancer cells and they die. So if you want to keep your breast healthy, if you want to keep your brain healthy, if you want to keep your cells of your body healthy, and you want to keep your thyroid levels good within your cells, it's really imperative that you take progesterone, and also for bone health. Okay. Question from Kathy. Will progesterone help shrink my uterus? That is the size of a, she doesn't say. Well, Kathy, if your uterus is enlarged and you may have uterine fibroids, yes, if you take progesterone, and it depends how long this has been and what age you are. If your uterus has just become enlarged over the last year or two, yes, it can be very helpful. If you've had this for 8 or 10 years, it's going to be less helpful because damage has already been done. But it's sure worth giving it a try. Y'all are asking some really good questions. Okay. I'm a 52-year-old woman, and I've been using progesterone cream for a year now. Should I be adding estrogen to this? If so, how much? Depending upon symptoms of estrogen decline, you may benefit from a little estrogen. Remember, estrogen can cause hot flashes, night sweats, vaginal dryness, some depressed moods, loss of romantic moods and inclinations. If you have any of those symptoms, you can take it. But remember, women, and depending upon your size and how much fat you have on your body, if you're a little bit overweight, you're going to be making quite a bit of estrogen in your fat cells, and you may not need any at all. If you're very, very thin and you've got those symptoms of estrogen decline, we would always start on small doses of estrogen, just enough to relieve the symptoms. Good question. Here's a question about adrenal fatigue that Andrea asks. Can adrenal fatigue cause all your other hormones to be way out of whack? Well, absolutely. Your adrenal glands are located on top of your kidneys in your back. They're about the size of a walnut, and they produce stress hormones like adrenaline. You've heard of adrenaline. That's the hormone of fight or flight. It's the hormone you get before you get really excited at a big football game, or if you happen to have somebody burst on the scene, or maybe you get in a wreck, or something happens to your child. You have this burst of strength and energy, and that's caused by adrenaline. It's the fight or flight hormone. It's for acute stress. Now, when a person has chronic stress, the stress from, let's say, chronic allergies or asthma, or from recurrent and chronic pain, or from loss of a loved one, or a breakup in a marriage or relationship, driving the freeways in a metropolitan area, trying to raise a husband, trying to raise kids. All these things can cause stress, and that stress becomes chronic, and the ovaries become fatigued. I'm sorry, not the ovaries, but the adrenal glands become fatigued, and the adrenal glands produce cortisol trying to relieve the stress, but when they become fatigued, they don't produce enough cortisol, and that adversely affects your other hormones. It adversely affects your thyroid function. It adversely affects your natural sex hormones. The hormones work together synergistically. So that's why here at the Hotze Health and Wellness Center, we don't just give one hormone. We give small amounts of each one. When we have adrenal fatigue, we'll also add a little bit of progesterone, a little bit of thyroid. You don't need them all. You don't need one, but you need all in small amounts to help balance out your hormones. Well, I think we have time for one more question. I have had a total hysterectomy and have a sister with breast cancer and a mother with ovarian cancer. I am on Premarin and was told that I should not have progesterone since I don't have a uterus. I am a bit confused by my doctor's take on progesterone. Well, go to my website, www.hotzehwc.com, or even better, get a copy of my book, Hormones, Health, and Happiness. Hormones, Health, and Happiness. And you can get that on Amazon.com. As a matter of fact, Patty, if you'll call our office here and visit with one of our new guest consultants, and that number is 281-698. What are the last four digits? 281-6... 281-8698. That's area 281-698-8698. 281-698-8698. You can visit with one of our new guest consultants. And I'd recommend for any one of you that would like to discuss your problems in more depth, we have outstanding new guest consultants that will take all the time you need to listen to you and understand what your needs and what your problems are, and to see if it's a proper fit for what we'll be able to do to help you. And Patty, if you'll give them a call at that number, I will, and that's 281-698-8698, 281-698-8698. If you'll call that number, I'll get you a copy of my book, Hormones, Health, and Happiness. Does that wrap it up?
Yes, it certainly does, and you're right, Dr. Hotze. In fact, anybody that calls that number today and today only will get a complimentary copy of Hormones, Health, and Happiness. So anybody listening right now, if you would like a free copy, basically, give them a call. The number is on your screen. There's a 1-800 number on your screen, but you can call the 281 number that Dr. Hotze just gave out as well. And I also wanted to just touch base on one last thing before we wrap it up. Barbara, I saw your question. We didn't get to it. I wish we could have. You're asking, why is hypothyroidism such an epidemic? Are we doing something wrong? And the answer is yes. And guess what? Dr. Hotze goes into detail about that in his book, Hypothyroidism, Health, and Happiness. Another book that he wants to give you for free because he cares. That's how much he cares. He wants you to be educated on this topic, and you can go for your complimentary copy of that to thyroidanswer.com. What's happening is that, in a nutshell, the diagnosis is not being made properly. It's going unnoticed. So people are not only not being diagnosed with it because they're being diagnosed based on blood test alone, but also they're not being treated optimally. So this is an epidemic, and we want you to learn about it by going to thyroidanswer.com as well. Thanks so much for being here. If you have any other questions, make sure you call that number on your screen. Our new guest consultants are standing by to answer those questions for you with smiles on their faces. Thanks so much for listening.